Next, I want to welcome up to testify Chairman Austin Lowe's. Chairman Lowe's is chairman of the Sault Ste. Marie Tribe of Chippewa Indians, the largest tribe east of the Mississippi, and I would say the greatest tribe east of the Mississippi as a member. And I want to thank you for your leadership on helping this program be extended to residents in the Eastern Upper Peninsula. So thank you for your testimony today.
Good afternoon, Chair Irwin and members of the committee. Thank you for the opportunity to speak on behalf of the Sault Ste. Marie Tribe of Chippewa Indians about the RX Kids program. For those who aren't aware, the Sioux Tribe is the largest federally recognized tribe east of the Mississippi River. Our 7-county service area covers the eastern half of the Upper Peninsula, where we provide a wide range of services to our members, including education, healthcare, recreation, cultural programming, and so much more. Prior to being elected the chairman of my tribe, I was a social worker where I helped to connect Native families to critical resources to support their health and their well-being. So I bring to you today both my perspective as an elected leader of my tribe as well as my professional expertise. From my professional experience, I can confirm that the research is absolutely clear. The earliest years of a child's development set the foundation for the rest of their lives. 85% of the brain develops occurs before the age of 5, and the stressors that parents may face during and immediately after pregnancy, such as housing insecurity, lack of access to health care, income instability, can disrupt that development. And as any parent will tell you, having a child is so incredibly expensive. Hospital fees, food, diapers, and supplies can add up to tens of thousands of dollars in that first year alone. These costs can cause significant stress and instabilities for families. By closing these opportunity gaps and providing a more stable environment with less stress and more caregiver interaction, we can create solid foundation for lifelong success. So when my tribe learned about the RX Kids program and the opportunity to help provide stability to families, we were so eager to help bring that to our region. RX Kids was made available to families in 5 of the 7 counties of our service area, and that includes Luce County, Mackinac, Alger, Schoolcraft, and Chippewa. And even though we're just 6 months into this program, we're learning that providing expecting mothers with $1,500 during their pregnancy and $500 a month for the first 6 months after birth has been completely transformative. So far, 307 families have been enrolled and 179 babies have been born under this program, with about 25% of them being Native American families. The initial surveys coming back tell us that the top 5 things that mom used this unrestricted cash for is baby supplies, food, utilities, rent, and clothing. 84% of moms in our region told us that RX Kids helped them make ends meet financially. 65% say that RX Kids has made it easier to get the health care that their household needs. 68% agreed that RX Kids has helped improve their health and their infants' health. To quote one mother enrolled in the program, RX Kids has made our lives less stressful and it's allowed us to make healthier choices. Another one told us that using RX Kids payments to cover unforeseeable medical bills during my pregnancy greatly reduced the amount of stress I felt during this time. I was able to focus on caring for myself and my baby. This tells us that this program is working exactly as it was intended. It's creating stability, reducing stress, and allowing parents to focus on providing the care and attention that their kids need. My ask for you today is that I urge you to continue investing in RX Kids. This is a model program that is creating healthier children and stronger families. And it's an investment that Michigan is making that will return a lifetime of dividends for our communities. Thank you.
Thank you so much, Chairman Lowe's, for your leadership on a wide range of issues, but particularly for your testimony today and your leadership on RX Kids in the Eastern Upper Peninsula. I want to recognize Senator DeMoose.
Thank you, Mr. Chairman. You know, one thing I want to make a point of, and this leads into my question, is that we have this report from the Senate Fiscal Agency that says that this could cost the state $750 million. But it's really important to remember that the program is actually very much dependent on a public-private partnership with lots of contributions. And right now, if I'm not mistaken, it's running at about 5-to-1 of private and other groups donating money versus $1 spent by the state. So I don't think we're going to ever get anywhere near $750 million of state funding based on the way the program's run. So if that's true, I want to make sure that we understand, what does this look like to a donor? And so you've contributed, your tribe has stepped up to the tune of $200,000 in the Eastern UP, which I thank you for as a person who represents that area. But you're approached by so many different ways you can become involved in society and everybody comes to you, I'm sure, asking for help with things. How does this program stack up to other things? And what makes this appealing so that we know, because it's important we understand that, because we don't want to spend $750 million of state funding. We need the donors to contribute to.
So I appreciate that question, and it's true that the Sioux Tribe has donated $200,000 to this program. I'm incredibly grateful for my tribal council to make that pledge and that allocation, and quite simply, they did it because they believe in this program. And how well this program stacks up to other programs, it's the best program I have seen, you know, which is why we made the contribution. I mean, any investment that you make in your children is an investment in your future. And in my tribe, we talk a lot about the 7 generations, leaving the next 7 generations in a healthier condition than the current one. And this program definitely achieves that, and we're so grateful that it exists.
Chairman Lowe's. Oh, wait, we see another one from Senator Schenk.
Thank you. I think one of the things that really, when I'm looking at the map of the places where this program has been functioning for a short time and where it's planned to come online, is that it's all over the state, that the need is across the state. And in my district, because we have to ask a question, I'm going to ask you a question. In my district, there are families who are living on $10,000 and less. Do you think that could make a big difference in their lives?
Absolutely. I think it will make a big difference in families' lives that earn much more. I mean, in my community alone, the cost of living has gone through the roof. The cost of housing has skyrocketed. Every little bit helps. And I mean, it wasn't that long ago where I had my second child and I was in grad school studying to become an outpatient therapist. And the organization had a rule, like if you didn't accept insurance, you could get $2,000 back, which isn't that much different than what this award is. And I was one of those families that, you know, I'll rely on my tribal health center to meet my health care needs, and I'll take that $2,000 because it's so expensive raising kids. I've been there, you know, you guys approving this, it helps so many people.
Thank you again, Chairman Lowe's.